Imagine this. It's 100 AD. You're a Roman soldier with a head wound. A doctor approaches with a bronze drill. No anesthesia, no germ theory, just a steady hand and a prayer. And somehow it worked. Romans performed brain surgery, used spider webs as bandages, and treated infections with moldy bread. 2,000 years before penicillin. So, was Roman medicine advanced science, or just lucky guesswork? The truth? It was both, and it changed medicine forever. Let's start with the most shocking fact. Romans did brain surgery. Archaeologists have found skulls across Europe with perfectly drilled holes, healed over, proving the patient survived. This procedure, called trepanation, was used to treat head injuries, seizures, or even evil spirits. Their toolkit? Bronze scalpels, bone levers, and forceps sterilized by boiling or flame. Pain management? Opium, mandrake root, or wine? Not exactly reliable. But Roman military medics were trained to work fast, clean, and precise. In fact, survival rates for battlefield surgery were higher than in the American Civil War, 1,800 years later. Now about those spider webs. Yes, it's true. Roman doctors pressed clean spider webs onto wounds. Why? Because they noticed it stopped bleeding and prevented infection. Modern science confirms it. Spider silk contains vitamin K and natural antiseptics. And moldy bread? Applied to infected sores. We now know certain molds produce penicillin-like compounds. Romans didn't know why it worked, they just knew it did. They also used honey, natural antibacterial. Willow bark contains salicin, the basis of aspirin. Garlic, antifungal, antiviral. This wasn't magic. It was empirical observation, trial, error, and record keeping. But Rome didn't stop at field medicine. They built the first organized hospitals in history, called Valetinaria. These weren't just tents. They were permanent stone buildings with separate wards for surgery, recovery, and contagion, running water from aqueducts, kitchens, pharmacies, and operating rooms. Every Roman legion had one, staffed by trained medici, doctors, and capsarii, medics. Soldiers received daily checkups, wound care, and even mental health support. Roman texts mention battle fatigue. This was systematic, state-funded health care, 1,900 years before the NHS or VA hospitals. So where did this knowledge come from? Rome stole it from the Greeks. After conquering Greece, Romans adopted the teachings of Hippocrates and Galen, the father of Roman medicine. Galen, a Greek doctor in Rome, dissected animals, human dissection was banned, mapped nerves, and proved the brain controlled speech. But Rome added something Greece lacked: scale, discipline, and data. Every legion medic kept records. Treatments were tested across 30 provinces. This fusion, Greek theory plus Roman engineering plus military urgency, created a medical revolution. You might think this is just ancient history, but Roman medicine shapes us today. The first aid kit, invented by Roman medics. Triage systems, developed in legion field hospitals. Antiseptic wound care, they pioneered it with honey, wine, and yes, spider webs. Even their biggest flaw, ignoring germ theory, teaches us humility. Because real progress isn't about being perfect, it's about observing, adapting, and never stopping. If you're amazed that brain surgery existed in ancient Rome, you're not alone. This is just one chapter in Rome's forgotten tech revolution. Subscribe and hit the bell, because next week, we reveal how Roman concrete heals itself and why modern engineers are begging for the recipe. Back-end index pointing down, comment below. What shocks you more, spiderweb bandages or moldy bread antibiotics? And if you love history that actually changed the world, give this video a like. It helps more people discover the genius of the past. Thanks for watching. This is History and Storytelling Inspired, where history isn't just remembered, it's re-engineered.